Ladies and gentlemen, help me welcome once again Dr. Cyril Wecht. Take her away. All right, well, while Jim is setting up things, let me move ahead very quickly. Folks, it's late. A tough act to follow. I haven't had so much fun since the same year I dated Miss Pennsylvania, Miss University of Pittsburgh, and Miss Israel. It's been same year, not the same night, same year. I want to clarify something. One of the people at my table wasn't sure about when I referenced the testimony to the House Select Committee on Assassinations. I'm sorry. Yes, I did testify. I thought I did say that. I referred to Pierre Fink when they gave my talk at the American Academy. I sat next to Pierre Fink. He came and sat down next to me, and I hadn't met him when I was in the Air Force. I went up to the Armed Forces Institute of Pathology for some forensic pathology sessions, and said Pierre, and I asked him a bunch of questions. He was so distraught. He was a gentleman from Switzerland, a very ethical kind of a guy, he said he was not permitted to talk, and he could not discuss the case. That was 1965. So let me move on. Now we're at Parkland Hospital. The medical examiner of Dallas, Dr. Earl Rose, who was a colleague of mine, a contemporary of mine, was there to take possession of the body and do the autopsy. Qualified forensic pathologist. He was pushed aside, threatened, actually pushed up against the wall, and the feds left. That was a violation, taking the body out. So, all right, they take it, no problem. We know when he was shot and where he was shot, and we know the time, unlike many other cases. They had all the time in the world then to contact the top forensic pathologists in the country. These are the people that gave lectures at the AFIP, and I had met them. Dr. Milton Halpern from New York City, who was the dean of forensic pathology, he had already packed his bags. Not arrogantly, he was certain, there's no question. And I've said this, by the way, anybody that can find a case involving a president, prime minister, premier of any country, including dictatorships, where someone has been assassinated or died under controversial, mysterious circumstances, where that autopsy has not been done by the top people in the Institute of Forensic Medicine, whatever it may be called, you let me know, and I'll give you a trip to the Caribbean for a week, okay? Never happened. I don't give a shit if it's China, Russia, Palme in Sweden, the Institute of Forensic Medicine, whatever it may be called in that language, that's where the autopsy would be done. Right. Not one of these guys who had lectured at the AFIP, who taught the people who became military forensic pathologists, was called in to do this autopsy. So who did they call in? Ewens and Boswell from Bethesda Naval Hospital, who had never done a gunshot wound autopsy in their entire lives. I'm going to repeat that for you. Yeah. Never done a gunshot wound autopsy in their entire careers. Do you know what the hell it's like to do an autopsy with multiple gunshot wounds, determining exit and entrance, and then correlating with the wounds in Governor Conley? It's a major undertaking. You'd be there for hours, 2 or 3 guys working together. Now, Pierre Fink then was called over as an afterthought, arriving after the brain had already been removed, the skull already examined by Ewens. I can tell you, I did 4 years of pathology training at damn good places, 2 years at the University VA, 2 years in the Air Force at a major center, and until I went into Baltimore to do my medical examiner forensic pathology training, it was a whole new world. So that is what takes place. They move the body, and then there are custody problems, and the attorneys in the audience can appreciate that. You get ripped apart in terms of the custody from this kind of transport to another, from one bag to another. That's a whole other problem. And now we move into the Bethesda autopsy suite. I've already told you then about their absolute lack of training. I've already referred, I believe, to, let me emphasize that again, they had hours to talk with the doctors at the Parkland Hospital. When we have a complicated case, I do autopsies still for 4 coroners and DAs. I was coroner for Allegheny County for 20 years, 2 separate year stints like that. When you have a case like that in which the surgeons have been involved, you've got to talk with them. You don't know what the hell they've done.
Right.
They don't do anything malevolently or negligently, but when you have a wound, to be specific, you want to get to the site of the bleeding. You're not going to screw around somewhere else, so you'll go through. In many cases where they've gone through the stab wound, gone through the gunshot wound, expanded upon it, you want to know that information. They had hours went by, no communication between the people being lined up to do the autopsy and the doctors at Parkland. They should have also had a preliminary report actually in writing. It should have been transmitted by the doctors there. The Secret Service people should have made a report, but none of this happened. So now they proceed with the autopsy. And you know some of these details. Failure to recognize a gunshot wound in the neck, looking at it as a tracheotomy, not realizing for one moment. A sharp forensic pathologist would have seen, you can still see the edges. You've seen pictures of it, but nobody has talked about that. Believe me, you can see an edge of a suggested gunshot wound. That was never probed. Not that they were covering up, they just never thought of that being a bullet wound. Then they have a bullet wound in the back. They probe first with the finger, feel nothing. With an instrument, feel nothing. Take x-rays, see nothing. Take out the lungs, find nothing. Now you can imagine, just close your eyes. You're a pathologist, you're doing an autopsy on the President of the United States, you've got a gunshot wound, and you're not finding the fucking bullet. Okay? You've got to be shitting in your pants. You've got to be shitting in your pants. Well, they were saved. Information came in from the FBI in Dallas to the FBI in DC. A bullet was found beneath a stretcher. All of a sudden, there's a stretcher. A maintenance man, thank God, had to go and urinate. Moving the stretcher, blocking his way. He lifts it up. Still some question, was it on the stretcher, was it beneath the stretcher? But there is a bullet, conveniently located. Ah, said the pathologist, and I want you to think about this for a moment, that when the President lay supine, the doctors applied pressure to the front of his chest for cardiopulmonary resuscitation. Pressure applied to the front of the chest forced a bullet that they knew had gone in beyond the length of an adult man's finger back out through the same hole. You know, in Pittsburgh, we've got these big tunnels that go through the hillsides of Pittsburgh. And I always tell people in Pittsburgh, remember, next time you're going into the Fort Pitt tunnels and you decide you're going the wrong way, just put your car in reverse back up. Okay? Bullets don't work that way. Bullets don't go in and out. The tissue swells. The tissue becomes edematous and hemorrhagic. It encases and engorges the bullet. But that was their conclusion, that the bullet that had struck the President in the back had been forced out. Fine. And then the head wound, you know about, not going to repeat that, and they went home. It wasn't until the next morning when they called down to the doctors at Parkland and learned about the bullet hole in the neck, and that's when they now had to put together the entrance and exit, and then continuing with the single bullet theory. Next, Jim, please. I want to show you something. Read, 1960, Armed Forces Institute of Pathology manual on how to do an autopsy. First of all, let me tell you something. The AFIP, which was a mecca of pathology, not only for the military government, but we used it too, and civilians, if you had a difficult case, you'd send it to them, and they would give you their thoughts on whether it was this particular kind of cancer or sarcoma, and so on. This manual was available. But let's talk about the AFIP. Magnificent structure, right there on the campus of the Walter Reed Hospital, 5-10 minutes away. And who was present among the staff within that magnificent institution? Military board-certified forensic pathologists. I knew these guys personally. They were my friends in later years and colleagues. I didn't remember their names. Frank Keel, Bill Cerner, and others. Right there. I've referred to the civilian forensic pathologists, New York, Boston, Philadelphia, Richmond. These were the major people. All right, you don't want to use civilians? Then how's about using your own people? They didn't call upon these people. Just picture, if you will, to get this point across, the president, instead of being shot that day, had slipped in his bathtub, struck his head, was knocked unconscious briefly. Who would you call in to examine him? Everybody would say immediately, neurologist, neurosurgeon. You want an internist to check his cardiac and respiratory status. Somebody who knows a little about medicine, you say you want an ophthalmologist, because sometimes an intracranial bleed will be manifested upon ophthalmological examination. What if, under my retrospective hypothetical, the president, having been knocked unconscious, they called in a dermatologist, a plastic surgeon, and an obstetrician? You like that? That's exactly what the hell you had here. The control, there's no mention of the adrenal glands. The adrenal glands have not a damn thing to do with the death, but to show you the control, because Kennedy did have Addison's disease, depletion of the lipoid material in the adrenal glands from the past history of medical care and treatment and so on. So there's no mention. This I give you only to illustrate the control. In talking about control, there were 33 to 40 people. I just talked yesterday with Jim Jenkins, one of the autopsy technicians. How many people were in the gallery? I always use the number 33. He said there could have been as many as 40, including an Army general and 3 admirals. Berkeley, Galloway, and another one whose name he didn't remember. Have to look it up, okay? When Fink, who had, I told you, some sense of what needed to be done and wanted to do some further dissection, he asked about who's in control here. A voice from a general in the gallery said, "I am, doctor, you just proceed." This was the control. Who does an autopsy of this nature with 33, 40 people? This was a controlled military situation from the very beginning.
Mind control.
I'm going to go through these. I'm not going to read them to you. The purpose in including these is simply to show, where Jim, where are you located? I'm waving my finger. Oh, you see my finger? Okay. The purpose of this is to show you, you can't read it, it's too small print, to show you the details that are outlined in the AFIP manual. They had it there. If they needed anything, to show you the fact that they were aware, should certainly have been aware of what was required. And it goes on. I would like to read you some of the language that tells you what to do and how to do it, how to proceed. All not ignored. They weren't even aware of it probably, because I repeat, they had no forensic pathological background or training. And it goes on with more details. Now, for about 20 some years, I had a book I called the Legal Medicine Annual. And I would reach out to top people in field of legal medicine, forensic science, the various subdivisions, pathology, toxicology, entomology, etc., as well as top-notch trial attorneys, and had some magnificent chapters in there. So in 1973, I thought, what'll be a great chapter? Reports in the assassination deaths of President John F. Kennedy and Senator Robert Kennedy. Post-mortem protocols in official medical legal investigation, a study in contrast. And this is the study in contrast. Dr. Tom Noguchi, who remains a dear friend of mine, alive, 92 years old now. Tom was the chief medical examiner of Los Angeles, and I was a consultant to Tom and Marilyn Monroe, Patty Hearst, and Sharon Tate, and then Robert Kennedy. And by the way, there was a reference and discussion a little bit ago, and you see people just pick up thoughts and they run with them and they express them. They're talking about Sirhan as the assassin and so on. Okay, I'm going to interrupt myself. A fast show of hands here. Not a show of hands, a yelling out. And don't hesitate, please, quickly. It's an appropriate parenthetical intrusion by myself on my presentation here on John F. Kennedy. We'll come back to it in 30 seconds. But what was your recollection, what is your memory of the distance between Sirhan? There's a senator. I'm looking at Senator. He's walking toward me. He's just given his victory speech at the Ambassador Hotel. He's walking toward me, and I'm Sirhan, and getting ready to shoot. And I do shoot. What was this?
6 feet.
6 feet. Thank you, thank you, thank you, thank you. I'm waiting yet. Probably cumulatively about maybe 10,000. How's about, yeah? How's about 1 to 1.5 inches? 1 to 1.5 inches. That's in the official postmortem protocol signed off by Noguchi. Members of his staff reviewed the case. 3 military government pathologists. I got a call 3 o'clock in the morning. That day my wife was in the hospital having delivered our 4th child, our lovely only girl. And I was leaving the next morning with my 3 little boys to lecture at a NATLA program, Association of Trial Lawyers of America Plaintiffs Group in D.C., and then on to Puerto Rico. The phone rings at 3. I said, God damn it. Again, Noguchi has forgotten the 3-hour time difference. He's calling me. It's Tom Noguchi calling me on, he didn't need my advice on how to do an autopsy, but we were good friends already, and he knew of my criticism of what had happened in Dallas, and he wanted my suggestions on how to prevent that from happening there. I said, Tom, and I gave him some ideas. Get in touch with Pierre Salinger. He's a Californian. He's a top guy with the Kennedys and so on. Explain things to him. And then, Tom, you act preemptorily. You invite the military government pathologists to come to you to be your guests, to be your observers. And he did, and that's the way it worked out. The autopsy is there. The attorney for Sirhan, Grant Cooper, an experienced criminal defense attorney, not some snot-nosed kid out of the public defender's office or court appointed, a top guy, never consulted a forensic pathologist or a ballistics expert, never had such testimony given in the defense of Sirhan, and never cross-examined Tom Noguchi on what was the distance, Dr. Noguchi, from which the shot was fired, and there it was on paper. Look it up. So I went ahead and I published both of those autopsy reports.
Good for you.
This is the detail of Noguchi's autopsy. And by the way, Paul Schrade, we had Paul on a magnificent program we did last year in May at Duquesne University Institute of Forensic Science and Law. I did it by Skype and talked to Paul, known him and worked with him and met with him personally over the years, and correctly stated he was wounded and very much involved. And he has gone to the hearings, I think 3 times at least. I think they've run out of them now on Sirhan for a retrial, kind of a post-conviction hearing. No effect at all. And it's right there on paper. I know I'm repeating myself 3 times. I'm not senile. But I want you to understand, right there on paper, what the distance of that shot was. There's not anybody in the world that ever has placed Sirhan within 1-2 inches of Bobby Kennedy's head. Nobody, ever. Because it did not happen. There was a second shooter. Sure, did Sirhan shoot? You bet your ass he shot, there's no question. Was there a second shooter? Yes, back to JFK. And here, so you can see my name on the bottom among the consultants. And you can see the military guys and a colleague of mine, Bill Eckert, now deceased. So, folks, I want to just tell you something. This is the language that I've used: obfuscation, full-blown cover-up, charge that he was fueling conspiratorial lunacy around the country with statements like the prior one, and that's my count of 65 to 85%. Don't let anybody get away with that kind of insulting bullshit. You're a conspiratorialist, you're a conspiracy theorist, and so on. We are the majority. God damn it, we're the majority. You name one issue, and at the peak, I remember our national television program, it was 82% in that poll. And most of the time, they were coming in around 75%. And as I've said earlier, it may have dropped. We are majority. How many issues can you think of where a majority of Americans have been in favor of a particular point on an issue, whatever it is, persistently over decades, despite all of the input by the government to ridicule, to insult, to defame, to bring scurrilous charges in different ways against people? I've paid my price 2 times and in such instances over the years in which you have had the American public, you name the issue. Things have changed. I remember the first time I came out in Pittsburgh, Allegheny County, about maybe some loosening of the abortion rule, and when I would give lectures on drugs, and I would mention that marijuana, and just classify it categorically from a pharmacological standpoint, a mild hallucinogen. I remember many of the teachers were pissed off at me. They were very, very angry. Now, I never suggested going and smoking it, but I remember when I first started to talk about this in the late 60s, I was like a monster, a devil. And now you know what's going on. I think 6, 8 states have legalized it for use, about 24 or more states for medical purposes, and so on. And I mean, so things change. I don't want to digress, but not when it comes to this. And so this is what I want to leave you with. I came to realize, I don't like to read things when they're up there, but you read it. No, I'm going to read this because I'm going to be wrapping it up now. In most cases, a political comment on be it JFK, RFK, Martin Luther King, Marilyn Monroe, in many other cases. It's about how the facts get manipulated by politicians, by some governmental agencies, and it's worth noting. The main point I wish to make is this. We as Americans are very smug. We're very chauvinistic, very arrogant. It's one thing to be proud of who we are. I'm a grateful American, and I applaud that. I don't want to be born or raised in any other country. But it's another thing entirely to be blind, to not recognize that we have in our government, and it's across all ideologies and party lines, many of the same subterfuges that go on in any number of countries around the world. This kind of stuff goes on. 2 weeks ago, I did a second autopsy on Whitey Bulger. Now, we all know about Whitey Bulger, okay? Yeah. And we have our thoughts and so on. But talk about setups. He was 8 months in solitary confinement in Florida. He was in a wheelchair, got a heart problem, he's had heart attacks. They sent him to this shithole in West Virginia, Hazleton it's called, and within less than a matter of 6 hours or so, he's already dead. In a wheelchair, they put him on the general population. And he was beaten to death. An iron lock in a sock, and beaten to death. This is America, as Bob Tannenbaum said. Whatever you think about anybody, I'm not defending what Whitey Bulger did. That's not the point. But is that the way you handle things? You know, we have this incredible naivete as Americans, coupled with arrogance. Oh, they do these things in China and Russia and Iran and other totalitarian nations, but not in America. The reason I'm not giving you a speech or a pep talk, but I want you to understand the magnitude of our problem. Yeah. When you find, for example, a situation like David Talbot, a highly respected author, an intellectual, and he comes out with this wonderful book, Devil's...
Chessboard.
Devil's what?
Chessboard.
Devil's Chessboard. And he called in New York Times book review, and he was told flatly, we will not review your book. Not review your book. So understand what we're up against. And amazingly, as it is in the general population, you got the New York Times on the left, you got the Wall Street Journal on the right. I get both newspapers every day, except when Wall Street Journal doesn't publish Saturday and Sundays, but every day I read the papers along with my Pittsburgh Post-Gazette and USA Today. When I read the Wall Street Journal and the New York Times editorials and op-ed page, I'm in two different worlds. I'm in two different countries. How can it be? The point I'm making is that we're getting blindsided, ignored by both sides. You can't get a damn thing done by anybody. And I'm just mentioning this. We've got to think, folks, individually, collectively. I wish I had a solution. I wish I had a proposal. I wish I had a modus operandi to suggest. But recognize what we are up against and appreciate the fact that this is a formidable opponent. And so in conclusion, I'll just note, we learned early on, and I talked with Andrew Craig, a dear friend of mine, an attorney who's so active in Washington, D.C., with the news media and so on, and he agreed, I'm sure everybody else would too. How long would it have been after Kennedy was shot before the top people, Khrushchev, I believe it was at that time Mao Zedong in Beijing, Castro in Havana. How long do you think it would have been before those people would have been contacted by phone directly with our ambassadors going there to them and asking them, don't bullshit me, baby. Did you have anything to do in any way at all with the assassination of our president within hours? Because if you did, baby, there's not going to be any Moscow or Beijing or Havana left by tomorrow morning. Okay? Those calls were made. And they learned damn fast that it wasn't the Russians, it wasn't the Chinese, it wasn't the Cubans, it was us. That great, wonderful comic strip years ago, The Possum Pogo. We have met the enemy, and he is us. That, my friends, is our dilemma. The enemy is us. Keep it in mind.